So it's been 3 years since Will's surgery, and I think that my husband and I and Will would all agree that it was the right decision for him. He's done really well. He did eventually get back to his baseline of going to school every day by freshman year, so it did take him the rest of his 8th grade year through the summer. So it did take a substantial amount of time, and I think longer than we had anticipated. He's able to sit comfortably. It has changed the way he's able to be transitioned and moved. Thankfully, we had already had a lift in place, but I'm no longer able to physically transition him. My husband still can. Thankfully, he's a strong guy. But he's solid. He has still grown, which was surprising to me because I thought he wouldn't grow so much, but his limbs are still growing. So he's getting taller. I feel that he's able to engage back into his normal things that he enjoys. And overall, I do feel that potentially it's improved some of his respiratory issues. Just that he's able to sit up more comfortably for longer periods of time. But I don't really have any data around that.
So one negative was that he is harder to transfer. I think I heard you say, and that's I think that's almost universally true, and again comes as a big surprise to many families. Well, the spine's straighter now; everything should be better. Well, it isn't necessarily. And one way to try to understand what it's like is if you put the person in their body jacket and get it nice and tight and say, okay, now this is what transfer is going to be like afterwards. It's going to be like being in your biggest possible body jacket. What did you...
I would say that actually was one of the benefits as well. Will did really well with the body jacket, and I think, it was a blessing and a curse. It kind of allowed him to not have surgery as long as he did, but then when we got to the point, we really didn't have a lot of time. But he, the body jacket, he often would get overheated, so he's much more comfortable without that now.
Other negatives?
I think that he did have other medical issues that came up, and I think one of the concerns in hindsight, I think that we just thought he was uncomfortable at times in his chair in his recovery process due to discomfort or pain or getting used to his new body, when actually maybe it was gallstone pain he was having. So it took us a little longer to uncover some of the medical stuff happening to him between gallstones, later kidney stones, and then he also has some new pulmonary blebs that have developed that we're finding out may be something that happens more frequently with kids with his diagnosis of MTM. We're unsure of when that started, if they might have been present pre-surgery, because they're very unusual, or if this has accelerated post-surgery. It's kind of hard to know. So there's been other medical journeys that we took after spinal surgery that, it's hard to know if it was a causative or if it just the timing of it.
Erin, I think it's an important point that you raised about these coexisting conditions and how they can contribute to pain and discomfort, and untangling how much of those symptoms are attributable to those things and not the spine versus the spine, even pre and post, can be very tricky. And sometimes you can untangle it, and you're sort of just making your best guess about sort of what's happening in order to proceed.
I would say one thing, for anyone that is a wheelchair user, thankfully my husband was able to adjust his wheelchair following right after, but he grew substantially, inches. And for people, and that's a systematic issue, is the difficulty of getting wheelchair equipment companies to come timely and adjust chairs and get new parts if necessary, and the hospital can help assist with that. But that's something that is really important to be thinking ahead of time. And had we not had my husband's abilities, that probably would have not gone well.
And sometimes if a new chair is in the offing, it's best to postpone the new chair until after the spine surgery, because the chair requirements can be quite different. And the insurance, the payers are not going to be interested in paying for another one 6 months after they just paid for the previous one.